Tonight with a federal investigation into chronic staffing concerns at Southern Colorado hospitals.
A U.S. Senate report says Common Spirit Hospital ER doctors are worried they couldn't respond to a mass casualty event. KRDO 13 investigator Quinn Ritzdorf is live from Penrose Hospital to explain the concerns and ongoing investigation. Quinn.
Yeah, Bart, Heather, U.S. Acute Care Solutions is a private equity-owned company that staffs Common Spirit hospitals throughout Southern Colorado, including the one behind me. But a U.S. Senate committee is worried hospitals affiliated with private equity companies are putting profits over patient care, and that these hospitals are so understaffed they couldn't handle a mass casualty event. U.S. Acute Care Solutions staffs all 4 Common Spirit hospitals in Southern Colorado. And this letter from a U.S. Senate committee includes concerns about staffing at ERs here. It's looking into allegations from doctors that private equity hospitals make decisions based on their bottom line, not patient care.
They look at metrics and numbers and generally the bottom line, and how do we make this contract that we purchased, that we're investing in, how do we make it profitable, as opposed to how do we serve the patients best.
Jonathan Jones is a doctor in Mississippi. He says he saw about 8 to 10 patients at one time before a private equity firm bought his hospital. That number climbed to 20 after that private equity firm took over.
Is the doctor going to get you confused with the other patient that was kind of your same age and gender and also had chest pain like you? Are they going to look at an EKG and instead of spending 2 minutes reading it, are they going to spend 10 seconds because they're rushed? If those are things that happen when staffing levels change.
During a Senate subcommittee hearing last week, another emergency physician from Boston voiced her concerns.
Practicing medicine in PE-led places is no longer about patient safety or quality, but about making medical decisions and judgments due to corporate decision making with profit motives at the expense of patients.
These staffing concerns is why the federal government is worried private equity ERs can't handle an influx of patients in a mass casualty event. U.S. Acute Care Solutions says its hospitals have already proven it can do so by responding to mass casualty events like Club Q. They tell KRDO 13 investigates they are ready to provide care in any emergency situation. The U.S. Senate committee is asking U.S. Acute Care Solutions and its private equity owner for staffing and patient care protocols. We reached out to Common Spirit, but are still waiting to hear back. Reporting live in Colorado Springs, Quinn Ritzdorf, KRDO 13 investigates.